Okay,
All right.
Jennifer, Jennifer. Thank you so much for taking your time out of your day for this.
No problem.
Let me share with you again, just so we can have it on the record as why I'm doing this, because I think it's important to know the motivation behind this, okay? I am not an artist, not even close. And as I've gone through this pandemic, I've heard from many, many different people all across, the media and all across the town, that people who are affected by it, but are complaining about it and saying that it doesn't really exist, or why am I doing this? Or, I lost all my money and so on and so forth. And I realized that it's happening out there. It's affecting people out there, but we don't know about it. And I'm just a little civilian. And I thought there's got to be a way to get people to understand this and the impact of this. And I thought if we can get this through a different medium like art, then maybe we can show people what's really happening out there. And that's the goal behind it, totally.
Okay.
So you're at St. Francis, yes?
Yes.
Okay, and you, what is your role at St. Francis?
I'm a licensed practical nurse.
Fantastic. And when did you decide to become a nurse?
Why did I decide to become a nurse?
When and why?
All right. I started at St. Francis as an STNA in 1996.
Okay.
And I worked there for 11 years as an STNA. And I decided I wanted to do more for the residents out there. So I went to school and became a nurse. And I've been a nurse ever since.
Fantastic.
In 2007.
Fantastic. Well, then you have to be able to like it then, I would think, at this point, because you've been with it so long. Fantastic.
I'm a lifer.
Yay. I'm so glad you're there. I'm sure the residents are glad you're there too.
Yes.
Okay, so when did you first hear about the pandemic? What month, what year, and so on?
I guess the pandemic took effect on me probably around March of 2020.
Okay, tell me how that happened.
Well, I did do like an 8-hour shift, 40 hours a week there. And then in March, it switched me to 12 hours and I do 3 days a week now.
Oh.
And it wasn't like, it was just because they wanted us to go to 12 hours. I was just one of the last ones to be doing the 8-hour shift there.
Okay.
And I liked it because I ended up getting every weekend off, which has never happened for me,
rare.
Especially in, the nursing field. So I only work Monday, Wednesdays, and Fridays.
Yeah, the nurses are always short all the time. You're always short.
Yeah.
You're always being called in and everything else. Yeah.
So less days, then, you're more apt to pick up a little bit more.
Exactly.
Yeah.
Okay, so then that happened about what time then? March, April?
March in 2020, yep.
Okay, so then what happened after that as far as the pandemic is concerned? Did they give meetings on it?
That's when we started taking away the residents' family visits, and started they had to start staying in their rooms. We were trying to prevent the spread of the sickness. So then what I noticed starting in March was how our residents became more depressed. They didn't start or stopped eating as much,
Really?
Just kind of staying in their rooms. And we would try to do activities where they would sit outside their room, but it was just, it ended up once it started spreading, which we didn't really get a spread or even get the first COVID in there till probably September, I believe.
So you went from April to September and you had to keep them in their rooms, and you're thinking, we're doing all this, so we're not sure if it's the right thing, because they're getting affected by the distancing and not really, you don't see any disease yet.
Correct. We did keep the sickness out of there for quite a long time, but once it got into the nursing home, we knew we couldn't really prevent that, which the staff, we got to come and go. We had to, wear masks. Then we switched to, we had the surgical mask, and we had to switch to the N95s. Then we had to start wearing the shields and the goggles. Then we had to wear the gowns. So it was a lot of putting on to try to take care of somebody.
When did all that start, the PPE start really begin to ramp up? I mean, is that in the summertime or is that September?
It was more in September when we started getting the sickness in the facility.
Okay. When was the first resident with COVID? September was the first month for that?
Mm-hmm.
Okay. And then did you isolate them, or what'd you do with that resident?
Then we made a COVID unit, and I got to work that unit.
Okay. You volunteered, or they asked you?
No, we didn't really volunteer. We just kind of had to start doing it.
Okay.
Like my unit was the skilled unit. That's what I was in charge of, which of course we weren't really accepting residents from the hospital at that time because that was too dangerous to start bringing them in case they had the illness.
Mm-hmm.
So until we got it into our facility, that's when we did the COVID unit. I like took care of one person, and I would be the aide and the nurse.
Now, what you have to do when you say taking care of someone in the COVID unit, what does that mean? How's that different from anything else? Is it a?
Well, we isolate. We shut the doors. I can't leave that unit. I can only enter in one way and go out one way, and it's not with any other of the workers.
Wow.
And then, of course, I had to dress up in all the PPE.
Yeah.
Every time I wanted to enter the room for anything, I had to put the PPE on, and I tried to get my med pass and their meal and everything. So I could go in just one time instead of keep re-entering their room.
Mm-hmm.
I ended up, we started having I had 6 to 7 residents where I was still the aide and the nurse. And then once we got up to 8 residents, they started letting me have an aide back in the unit.
So how many so September you had 1. How many did you have in October? Give or take, approximately.
We stayed at 6, I believe, was the most we had all the way up till December. Okay. And then in December, that's when it really hit our facility hard.
When you say 6, you mean 6 that were affected by it, 6 that were sick, asymptomatic, and these were all residents, right?
Right. Most of our residents were asymptomatic.
Okay.
We, if they weren't, they ended up in the hospital, and they really weren't in our COVID unit.
Now, did you have to tell the residents that their relative had COVID?
Yes.
That had to be terrible to say that.
How did they affect, or how did they react?
It had to be terrible to say it. They have to say that to people. Oh my gosh. And
a lot of our, the residents' families, they got upset because, we had to cut off the visitation, which wasn't our decision. That's the governor's.
Right.
Of cutting off the visitations and stuff, and then of course they're oh, well, you guys give our resident COVID, and now we can't see them and they're sick, and you guys are the ones that are bringing it in, which it's not like we wanted to do that.
Exactly. It had to be terrible, though. You have to tell somebody that the person that you haven't seen for 4 months now has this, and you still can't see them.
Yeah.
Holy cow.
So in December, that's when we our facility we actually had to open up another unit. We had to have more staffing. They did start off doing a volunteer. If you wanted to work the COVID unit, you could make extra money, and you could work it. But once we started getting more residents around, this is part of our job, and we just had to do it.
Okay, so when you say 6, you mean 6 recovered, 6 did those 6 change? You had
those are we would do COVID test.
Okay.
We would have to test our residents. I don't remember, we started out once a week we were getting tested. Now we get tested twice a week. That we've been doing that for a while.
Okay. And
our residents wouldn't get tested unless they started showing symptoms. But then once we started having residents have it, then we had to start testing them, I believe, weekly. Okay. They would get tested once a week. Unless they would come and show a symptom, then they would test them otherwise.
What would be a symptom of COVID to the residents?
There's a lot of them. There's a cough, a fever, a runny nose, shortness of breath, nausea, diarrhea.
Was there a memory issue at all?
No.
Okay, because my mom had it, and she's 90, and her memory was gone for a month. She forgot everything. And then it came back.
I ended up getting COVID in December 21st, which
Oh
I
my
could not do
gosh.
Christmas with my children.
Oh,
I have a younger son. I have two older children. So my younger son ended up having to quarantine with me on his whole entire Christmas break.
oh,
My boyfriend, he's on dialysis, and he ended up getting it December 30th.
oh
And
my.
he ended up going to St. B's, and he was on the vent from January 3rd until January, I believe, 18th.
Oh my gosh.
And actually he coded in the middle of that. But he's home now. Like, he had to go to the St. Francis for 8 days for rehab. So I kind of went through what my residents' families went through, because when I was on my quarantine, I had to rely on the nurses at St. Vincent's to give me a report and let me know how he was doing, because I wasn't able to see him either.
And he coded, which means he flatlined.
Correct. I was at one of my son's basketball games, and the doctor called me and told me that they had brought him back by CPR.
Holy cow. That had to be, I mean, I can't imagine the guilt from that point, because you know you got it, you're thinking you got it from you, right? Maybe.
Correct. I mean, I feel like because I was working the COVID unit constantly, and so I felt like I was the one that brought it home to him, and then he has 3 children of his own, and I had to try to face them, like, because he was so sick.
Oh my gosh! Hang on, I gotta react. I just gotta hang on.
Okay.
Holy cow! Oh, I can't even imagine that. I can't even imagine that.
So I kind of went full circle with this whole situation.
Yeah,
I kind of had to go through what the residents' family members go through.
So you're sitting at the basketball game, and you get a phone call from the that comes up as the hospital, St. V, right?
Mm-hmm. Yeah.
And he tells you that, and you're sitting there trying to watch your son's game, and you just realize what is happening to your boyfriend. Oh my God, that had to be terrible.
Mm-hmm. And his parents were there at that game, because they were watching my son and his nephew. So I had to tell his mom at that game that, you know, he had coded. And then also the doctor's like, I don't know what his mental status is going to be. So then that was really scary, because they gave him a paralytic, which made him be paralyzed. Well, they kind of hindered him because he's on dialysis, so none of that medication could get out because he doesn't urinate.
Oh my.
And that's the way that you get that medication out. So they had to put him on continuous dialysis to get everything out of his system. So I already was having problems with him waking up from them doing the paralytic and also giving him the sedation to be on the vent.
Holy cow.
It was quite a...
So I can see now why when you have relatives complain that it's hard for you not to say, I know how you feel, but you say, I know how you feel.
Mm-hmm.
Wow. Okay. I know you've already lived it. I just did. So it takes me a while to get back from that.
Yes.
Okay. So the day he came to St. Francis, did you wait on him then? You was in your unit?
I was working that day when he came from the hospital.
Oh, that's fantastic.
Yeah. And so I did get to visit him because I work there. So I already, you know, am a part of that place. So I did get to come and see him and help him when he was there for the 8 days, which was easy, like made it easier on me. But technically he said it didn't really make it easier on him, because when I walked out of the room, then he missed me and he wanted to be at home.
Yeah.
So I'm not sure if visiting is a good thing or not a good thing.
But you know what? Maybe I don't know how many of your residents had dementia that were in the COVID unit, but that'd be tough. You know, I'm gonna go back a minute. When you start putting the masks on, did it affect the residents at all because they didn't know who you were?
It was hard for a lot of the residents because they couldn't understand what we were saying, because a lot of times they'll try to read your lips.
Oh, I forgot about that.
There was a lot of like trying to repeat, and they really didn't understand what we were trying to say to them.
Oh, I didn't think about it. You're right, because they're all hard of hearing anyways.
Mm-hmm. And like with the Alzheimer's residents, they're like, they want to see your face.
Yes.
That's how they know you. And so a lot of times if I work the Alzheimer's unit, I have a lot of problems with them taking their medication because they're not familiar with me.
Right. They're not going to trust you. They don't know who you are. Right? Some person with a mask comes in and says, take this stuff, and they're trying to kill me.
Yeah.
Wow. Okay, so that's fast. So your husband came home in January, you said, right?
Yes, well, January 30th, he got to come home.
Okay, so what you said it got bad in December. What do you mean by bad?
As far as with the residents or like at the facility
Yeah,
or
at the facility.
that's when like it hit our facility hard to where most of our residents got the virus.
Okay.
I think that it's possible maybe 3 residents out of all of our residents haven't had it yet.
How many residents do you have?
At that time, I can't give you a direct number
That's okay.
because
Exactly.
I was off of work as well, but we've been ranging between 65 and maybe 75 residents.
Okay, all right. So when you say, so let's say 70 of them got it or 72 of them got it.
Mm-hmm.
How many of them survived it?
We did have multiple deaths, but like I couldn't say they were from COVID because we do a quarantine of 10 days and they would be past that 10 days and then maybe it'd be 2 weeks later and they pass away. So I don't know that, because most of them didn't have symptoms. We didn't really have any that had any severe symptoms. Like I said, if we did, we sent them out to the hospital. But
Okay.
we lost, I wanted to say they said 23 residents.
Oh, wow. Out of 75?
Yeah, like, and of course we've like admitted some residents since then. So I think we're in the 68 range right now of residents in the facility.
Yeah, but still, so 22 out of 75, that's like 2/3.
Yeah. Mm-hmm.
Holy cow, I mean 1/3, holy cow.
And some of them like had gave up before they even got sick as far as they stopped eating. We have a lot of problems with them eating. They get depressed because they miss their families and being kind of isolated into their rooms and not getting exercise. Then they need therapy.
I can see that. Why should I even bother? I'm already at the end anyways. Why should I even bother? So COVID can directly affect you, especially this demographic.
Mm-hmm.
Can directly affect you because it affects your lungs and breathing, but also can affect you because you're being quarantined.
Yeah. The quarantine, wow. I think, is what hurt most of our residents to begin with.
Wow. And when you know they were going to die, did they? How many of them died there? Out of the 23, let's say, half, quarter.
I would say most of them, probably like 20 of them, because a lot of our residents are like what they call DNRs, where
right.
they don't go to the hospital. There's nothing that the hospital could do for them. We just keep them comfortable at our facility. And if you go on to hospice, or if we think that you're in danger of passing away, we do let the family come visit. Okay. They're allowed to have 2 visitors a day.
Was that even worse to see the family come in for the first time only to see them die, or was it at least they had that opportunity?
Well, even as we've started, like, because we have opened our visits since our unit like has gotten better, and a lot of our residents got the vaccine, we opened up indoor visits, and a lot of our family members will call me and be like, my family member is so thin. They've lost so much weight, and they're just upset once they see them. Yeah.
Because they haven't seen them in forever, and it's just a drastic change.
Because there are some residents that came straight from the hospital that their family hasn't seen them for months.
Yeah. And of course they're going to think that because it's a huge change when you're going from what they see them to 4 months versus seeing them every day would be a gradual change.
Yep. And they change in kind of looks as well, as far as like depression. It just makes them so sad looking. And
when you saw your first, let me back up to that for a minute. When your first visitor came in, how did the staff react to that? Because first, when you had all this death and everything around you, and I'm curious to know how the staff reacted to that. I mean, it had to be terrible.
Like when we had our first visit from indoor visits, or
yes.
I think we were all happy for our residents to be able to see their family again. It had to be. I mean, it's sad when we have to see the families that the resident was on hospice or they were passing. You know, we're there for them. We get them like trays of cookies and coffee, and we try to give them as much support as we can.
But I get it. But they're visiting somebody, waiting for them to die versus visiting them because they want to see them.
Mm-hmm.
So how did the staff handle all the deaths? I mean, that's a lot.
It's taken a toll on our staff. We've, you know, we have a spiritual coordinator that we can talk to whenever we're having a hard time with it. And it's changed so much, you know, it feels like a different facility to us.
It had to make you feel like, I mean, especially in the middle of it, like it's never going to end until everybody dies.
And they were shocked, you know, because some deaths we weren't really expecting, you know.
Yeah. I mean, I can't imagine when you have all this despair and death around you, and you're in the middle of it, that there is no end to it. That's how, I mean, you're used to it maybe because you're a caregiver, but I would just think that there's no end to this.
There's times too that we're happy for the resident, because some of those residents, they were ready. You know, they wanted to go. They've just been waiting for God to say it was their time.
That's a good way to look at it. So how did you know you guys were out of it then? I mean, what in this, when did you realize, okay, I think we're done with this? Was there a day? Was there a moment? Was there a shift? What?
Pretty much like once it started slowing down as the residents were becoming positive, because we do the 10 days and then they go back down to their room and go back to their regular, but it's not like we let them out of their rooms or anything, you know. So I think like when we first started seeing where it was getting better is once we started opening up the dining room and opening up activities and letting the residents come out of their rooms.
What was
once the CEO would, you know, like Gabe would tell us that we were ready for the next step. That's when we started seeing the end of the virus, or not, it's not really the end of it.
I know, but I know what you mean.
And more like when the residents got the vaccines too, that helped a lot.
How did you guys feel how did the residents react when they all came together in the dining room for the first time?
It's still a big change for them because they have to sit one at a table. Because we have to keep them 6 feet away from each other.
Right, but they could see each other though.
Correct. And it makes them happy. There are some residents that are enjoying like just being around another person, but there are still some residents that thrive to have that person sit beside them.
Exactly.
So that we're still fighting with because we can't do that. So it's hard for some, like especially the memory care unit, of them sitting apart. They still want to sit together. They feel like a family, and they want to, you know, go into the regular routine. You know,
what you share with me is amazing, and it makes me realize what my mom has gone through. And it's absolutely amazing with my mother that she's still positive. I mean, I can't even imagine it. And she's been, you know, I haven't seen her since, I think it started in June when I couldn't see her anymore. And she's 90 and she's got dementia. So it just reinforces the fact that my mom is like phenomenal. I mean, how you went through that? Holy cow.
Yeah. And I think sometimes them being memory impaired helps them too, you know, because the ones that have their right minds, they're the ones that know that they can't do something.
Oh, I didn't think about it. So dementia may help you get through this because you may not be as depressed because it's just that day. It's just that day that I can't see you. It's not versus that I didn't see you yesterday.
Correct.
Wow. Jennifer, I didn't think about that. So there's one benefit of dementia.
That could be.
Yes.
I mean, I see it as a benefit just because, you know, I work with them and, you know, they don't really have a routine.
No.
They just rely on us to keep them.
It'd be interesting to see the data on that. How many dementia patients passed away because of depression during COVID versus none? That'd be it.
And of course, you know, like dementia patients, they never pass away from dementia.
No, they don't.
They always pass away from something like pneumonia
Mm-hmm.
or something like that. So COVID it was hard with the dementia patients because I didn't know if they had a symptom. I would talk to a family member every day. They'd want to know, so how's my mother doing? And I'm like, well, she's doing all right. She's like, so she doesn't even have COVID. I'm like, well, I can't tell you that because she can't tell me that she has a sore throat. She can't tell me. The only thing I know is maybe if she's short of breath or she has a fever. Right. Because those are things I can check on. But otherwise, she could have other symptoms, like especially the taste and smell.
Oh gosh, yes.
You know, so and that really hinders a lot of people in eating.
Oh, you're right. And the main thing you have to be, I mean, not the main thing, but one of the big things that you look at from a person in a nursing home is, are they eating, are they pooping?
Mm-hmm.
And if they're not eating, something's wrong, and they're not pooping, something's wrong. And if they're not eating, it's because they're depressed. Well, how do you fix that? You can't. I mean, usually if they're not eating, and if they can't taste it and can't smell it, then why would they want to eat it?
Yeah, it doesn't even look good to them.
Oh my God, I didn't think about that. Holy cow. And how do you can't fight that?
No.
You can't make it smell better. No matter what you prepared for them food-wise to encourage them to eat, it's not going to make any difference.
No.
How did you fight the despair every day? And then you have to deal with your boyfriend and your son and everything. How did you do that? How did you do that, Jennifer?
I just go through my day and try to make them feel the best that I can. You know, they're like my family. I treat them like my grandmas and my grandpas and my mom and my dad. I mean, I've actually taken care of my father at the nursing home, and now my boyfriend went out there.
How much staff did you guys lose because the people aren't like you? Because you are phenomenal.
Well, thank you. We did lose some staff, but I think we, you know, like in nursing home and being an STNA is probably one of the hardest jobs ever. It can be rewarding, but it also can just suck too, you know?
It has to.
And the mandation is such a big thing. Like nobody wants to stay, but I stay because who's going to take care of them? Like they need us, you know? If somebody doesn't come to work that day, it's not like a factory where you just don't make that part.
Yeah.
You're taking care of a person. So you need to come to work every day. Like I probably can count on one hand in 25 years of working there how many times I've called off. And most of them were because of my children. Like my son was having seizures one time. Like if I was sick, I would just wear a mask and go to work.
You know, I guess what this pandemic has shown, especially in this industry, is who the true caregivers are. And you are certainly truly a caregiver. And you know what your purpose is, and you know that you take on responsibility easily. You know, this is my responsibility because these people somebody has to take care of them, as you just said.
Yeah.
Wow. I have a question for you. I had this idea yesterday, and I want to run it by you.
Okay.
You know, and I've interviewed, and we're going to have about 14 different stories and 14 pieces of art. It'll be about 2 foot by 2 foot, and you're gonna be able to have it in your home, have it framed and everything else. So you can have it in your home. So when your grandchildren and children say, "How was the pandemic, mommy?" You can say it was like this. And you can point to the portrait or the picture.
Yes.
But I was thinking, so here I've got coroners, STNAs, LPNs, RNs, New York City nurses, small town nurses in the hospitals. And I got funeral home directors, and also some first lieutenant in the National Guard who's helping out on the front lines as well. So my question to you is, what if we? And I just hit me yesterday, so forgive me for being scattered about this. But what if Congress created a program where people who are first responders like you would have the ability to either get education, to either get a master's in nursing or whatever, or transfer that education benefit back to your children, like the GI Bill?
That would be neat. Would
that be of interest to you?
Mm-hmm.
Because there's got to be a way for this country to reward people like you. I mean, this project with the art is just one way of, it was a nice gesture of saying, "Holy crap, you guys went through so much stuff. We want to say thank you." But I think as a nation, if we did that, it would show as a nation how much we appreciate what you guys went through, because you didn't go to school for the pandemic. You weren't taught in nursing school how to handle a pandemic.
Correct.
And so I think when you go to the military, you know what you're going to be in for, and you're trained.
Mm-hmm.
You were trained on the job for this. And so I think as a way to reward you guys is through education, whether you want to improve yourself or change your career or give it to your children. I think that's something I'm going to push for that. I did it before. I've gone through Congress before and got some things passed, like nationally, but I think we can do this. So when we have this event in either June or beginning of May, where you get to meet the artist and see if the artist really got what you were saying. I'm also going to have some psychiatrists, psychologists, national legislators and state legislators, and show them the impact that this pandemic had on these frontline workers, and say, we got to do something. And I think education is the way to do it. I think the opportunity for education is the way to do it. I think either you stay in the business and get your master's or get whatever, or give it to your children, or say, I want to get out of this business because I can't handle it anymore and I want to do something else. But I'm not going to pay for education to do that, because it wasn't my fault that I'm getting out of the business. It's because of the pandemic. So.
And I do have a daughter. She's 21. She's a medical assistant. Because she watched me work in the nursing home, and she worked in the nursing home for a little while, and she decided she wanted to go into the medical career as well.
Fantastic. Well, you know what? If she's anything like you, she'll be fantastic. Holy cow.
Well, thanks.
I can't even imagine it. I can't. All these complexities that you don't hear about in the news,
Yeah. And I mean, the nursing homes, they talk about it, but like, unless you work in a nursing home, you just don't know how it affected the poor residents.
No.
They're like, you get to go home, but I have to stay here, and some of them just wanted to go out to eat, they just.
Do you have any kind of, I know you have people you work with that you can talk about this with, but who else do you talk about it with?
I mean, I of course, my family, I have a great family and my mom was like the reason I became into the nursing career, because she asked me to become an STNA with her, and we worked together for many years. My mom retired, but I was her nurse and she was my aide.
Wow.
And a lot of people didn't like family working together, but me and my mom never let that be a part. They think about you'd miss work together if you had something bad happen or something like that, but me and my mom, we always worked together. And we worked in our assisted living and the skilled unit, and the residents, they ask me every day about my mom. Just to see how she's doing.
Holy cow. And now your daughter's taking up where you left off, your mom left off.
I don't know that she'll work in a nursing home, but she works at a doctor's office.
Regardless, she's in the caregiver career. Mm-hmm. That's regardless of that. Yes. What would you like when someone sees your portrait, your picture, your artwork? What would you like them to walk away with? What feeling would you like them to walk away with? When someone comes in and they see, they're going to see not you, but they see the artwork, okay? Mm-hmm. What would you want them to feel or think or walk away with?
I think I would want them to feel the compassion and the way that we care, about the person, and not technically just one person, multiple people, that we take care of.
And I hope that the artist sees that and hears that and can convey that. And how do you, I don't know how you draw compassion. If I would do that, it would be stick figures. So that's not very compassionate.
Right.
My artist ability stopped at the second grade. I remember I would do stick figures in first grade, and I put pants on them, and that was it. And so I stopped. So I hope that artists can convey compassion through art, whatever they want to do, because you certainly have it, Jennifer. Oh my gosh, you do.
Thank you.
Wow. Okay, we will be in touch as we progress through this, and I'll let you know when the artwork's done, and then when we're going to have the event. Also, I've done this too. I wanted to have two groups of people listen to the stories and create artwork from it. One is going to be a professional artist, which I said before, but the other one's going to be a high school student, because I want to try to get them to understand what's happening, because many high school kids live in a bubble. And
Yes.
I want them to realize this is what's happening out there, and you have to remember this. So you're going to have two works of art. One will be framed, which is the professional artwork. One will be the high school. It's more of you'll have both. Okay, you can take home both, but it's more of a gesture to the high school students to try to force them to realize this is reality. This is what's happening right now. But the professional artwork is a way for us to say thank you. And I got to tell you also, there's this community, Tiffin has had. I mean, they are supporting this project in a big way, because it's a way for them to say thank you publicly through this project. And the support I'm finding is just amazing. So when we had this event, you're gonna have a lot of people saying thank you that you never met before, that's for sure. So Jennifer, bless you. I'm so glad your boyfriend's back home. And he's I'm so glad. I just can't imagine that you had to replay that hit. I mean, I'm going to replay that in my head for a long time. So you get a basketball game, you get that phone call. Holy cow. Holy cow.
It was a crazy situation.
Big time. And you had to tell their parents. You had to tell his parents.
Yeah.
Oh. Wow. Okay.
Okay.
Jennifer, thanks so much. We'll be in touch.
Thank you. Thank you.
Bye-bye.
Bye.